Okay, let's get serious. Residency and fellowship, or start working as a PT? Which one should I do right after I graduate? Now, there are pros and cons, of course, for going to the residency and fellowship route, but there's also pros and cons on working as a PT right after you're done with school. So, which one should I do? Alright, so here are some facts that I heard about residency, just so you guys understand. Residency is something that you do after you go through your 3 years of DPT school. It's an additional year for residency and then an additional year for fellowship. Now in PT school, you go in learning how to be good at everything. So you have Peds, Neuro, Ortho, Acute care, all of that. Once you're done with school, you'll be able to sufficiently work as a PT to help these populations. Now, the point of residency is now, hey, after I learned all of this, I really like ortho, so I want to specialize in that. So now you have a specialization in orthopedics for physical therapy, which is your residency. Now, residency, it was created for basically entry-level PTs, which means after you do your 3rd year, right after you graduate, you're an entry-level PT. It was created for entry-level PTs so that it can thrust you, so that your skills can be accelerated and you can learn so fast so that by the time you're done with that 1 year, you're considered now an expert clinician. So, pros and cons of being in a residency. You get the mentorship hours, which is huge. You don't really get that anywhere else unless you're lucky and you have a colleague who really wants to invest in you. But residency is a time because you get that mentorship. So when you're working as a PT, if you were just going by yourself, you just work. No one's really watching you. No one's keeping you accountable. So if you're doing a skill wrong, or if you're just not really making progress, you might be able to ask your colleagues, but no one's there to really watch you and really help you grow to develop as an expert clinician. But in residency with the mentorship, you meet with your mentor, you practice your skills, you create weekly objective goals so that you are ensured that you're making progress every single week, so that by the year that's done, that's a ton of skills, tons of applications that you've learned that you can now just use, and it's now in your tool belt. So the accelerated program of this mentorship is huge. There's so many benefits. Now, residency is like a full-time job. Most of them are like 30 to 40 hours a week, but some of them are also part-time as well. It's like 20, 25 hours a week. Now, you are working, so technically you are getting paid, but you don't get paid as much. So that is a con. You do get a pay cut. However, a pro is that you get full benefits. Most programs have their residents get a pay cut, but you have full benefits. So this is dental, medical, all of that, PTO, time off, sick time, all of that stuff. Another pro for residency is that it helps prepare you for the OCS exam, the Orthopedic Certified Specialist exam. Now, this exam is something that you can take without the residency, but it's just an additional benefit. So along with getting your mentorship, you also are studying and preparing for the OCS exam. So by the time you're done with it, you have yet another thing under your name, in your resume, another 3 letters behind your name. But do not be mistaken, hopefully if you're doing residency, it's not to build your name and your reputation in getting more letters behind your name, but more because you want and you have the desire to become an expert clinician. And of course, whatever program you get into for residency, they're doing that because they're investing their time in you, because hopefully at the end of it, they are possibly going to think, all right, you did a great job, now let's hire you. So, job security. Now for some cons of residency, yes, you do get your pay cut. In addition to that, you have to delay your working time for being a full-time PT for another year or maybe 2 if you want to do fellowship. So that means all that money that you're in debt with, or I'm in debt with, kind of has to be delayed again. And honestly, being in the real world, and seeing all that debt that's accumulated, there is a desire in me that wants to start working because I want to start getting out of that hole. And another con with residency is that you have to do some research. So kind of like the capstone that I'm doing now, we have to do another one of those. And y'all know how much I like doing that. Okay, so big picture, as we take our pros and cons, this is how I see it. Yes, you're getting a pay cut. And yes, you're delaying your full-time whatever for another year or two. But you're still working, you still get full benefits, and you still get paid. So the way I see it is, yeah, you're delaying a year, but along that year, you're getting your education, you're getting mentorship, you're still getting paid, and you get the OCS certification after you're all done with it, and you get a job. So as of now, I think I might want to do residency. It seems like the big picture of it all, like the only con to me is like our pay cut. And yeah, I'm gonna be in a lot of debt after I'm done, but if it's another year of investment and through it all I get all these benefits, why not? I've been talking back and forth with my wife on whether I should or should not do it. She's super supportive of it. She says, go for it, do it. But you better be making a lot of money after you're done. But it's a time where I'm trying to figure out, should I do it, should I not? And I think at this point, I do want to do it. But who knows? It might change, it might not. I'll keep you guys posted, of course, in my vlog, so just be on the lookout for that. Alright guys, thank you for tuning in. If this video was helpful, please share this, please like it, please subscribe, and I'll see you next time, alright? Have a great one, you guys.